I think in a country like Nigeria, which is facing this pandemic with various issues already existing, issues, political issues, social issues, I think this pandemic just heightens some of these concerns that we have. And I think going back to what Amber said about violence, it's not that the pandemic is the reason for it, it's just showing this fault lines and this points that are causing, that are heightening some of these issues. And I think it's really important to highlight that Nigeria has, shown a strong response to this through the national control for diseases, and they've been focused on COVID, and our health system is really focused on it, and they're trying to address some of the economic impacts as well. But there are issues that we see in terms of if the health system is focused specifically on COVID, what does that mean for the other needs that we have? If, for example, we see a lockdown that's happening in at least 3 states in Nigeria, including where I live in Abuja, and in Lagos, it's happening in Ogun State. And then it's also happening in other states who want to make sure they're protecting their citizens. So there's curfews, most schools have closed right now, which we know that closures of schools means kids are at home. And that means it increases their risk of, related, but then where do they seek for help and how do they get help? And that's difficult to do when there's a lockdown, because it then means that, for example, you don't know who to call, you don't know who to ask for help, or even if you tell your parent or you tell a guardian, how do they know who to call for help? And so for a lot of us who were working on the ground, who are being forced to work from home, or who are being forced in a sense to say we can't no longer go into the community, large gatherings, you need to practice social distancing, so we needed to scale back some of our projects. But a lot of us came together and said we needed to have conversations of what do we do? How do we still continue to meet needs? How do we still continue to provide services? And what do we do during a lockdown? For some of us, we already are using technology tools. So for example, with Education as a Vaccine, we have a platform called My Question and Answer, because we already knew that just because of social, cultural norms, that getting access to SGBB information, getting access to sexual and reproductive health information that is accurate, that is non-judgmental, that is youth-friendly was already difficult. So we had already tried to create a safe space online through WhatsApp, through SMS, through phone calls, through Facebook, Instagram, all of the spaces where we know young people are, to make sure we're providing this information. So of course, but that means we only have access to young people who have information. So we have to start talking to different groups, and what you've seen on the ground is a response to that. So there's been a lot of radio jingles that have been happening so that we can actually share information. You've seen also reaching out, doing some level of outreach of those who are community workers, also sharing some of that information. And really us thinking through what are the advocacy we need to be doing as well at the national level and at the state level as well. And so one of the things we were pushing for is making sure that service provision still exists, and that it's important. And so one of the things we started pushing for was, can we make sure that gender-based violence services are essential services? Because what happens is that if you're deemed an essential service, then you're able to move around. Unfortunately for most of us, Nigeria as well, did not immediately say, oh, it's going to be an essential service. It required us pushing and having conversations and saying this needs to happen. But apart from that as well, even if we push for it to be an essential service, the question then becomes, if the gender desk in the police unit is open, if a shelter is open, how do we protect those who are providing services? How do we continue to maintain social distancing? How do we provide masks, gloves, sanitizers, all of those things? So we had to come together, some through fundraising, to raise money to provide that, or some through pushing and saying they deserve that if they're a government service, or to talk to those who are running shelters, who are having those conversations of, what level of protection can we provide? Can we let someone come in not knowing what their status is, because we want to protect those who are already in the shelter? So it became those kind of conversations of, could there be an isolation unit in the you provide sanitizers and things before they enter. So this is a lot of conversations we are in. I think I saw in Amber's presentation, we are in uncharted territories for the very first time in a long time. And this does feel like now more than ever is where we do need to be creative in terms of what we're pushing for. And we know that we cannot leave these issues of knowing that most young girls have been very susceptible to exposure to exploitation now they're at home, or worried in states where we pushed for girl education that now the school is going to be closed for a year. What does that mean? Because the likelihood of them going back to school now becomes an issue, right? Because you've already been successful first about making sure they could go to school, but then if they're going to be home for at least a year or how many months, then it's like, do they need to go back to school? Is it really necessary? Would they have money to be able to cover the fact that they would need to go back to school? Because even if school is free, there are hidden costs that you do see, and I think that's really important to highlight. But even in the caregiving role that they're providing, who has to go and fetch water? Who has, and all of those things. And if they're facing a lockdown, do they have to leave their community to go further to go get these resources to bring back? So there's really a lot of conversation in how we do it. So for us, like we've been pushing, how do we make GBV essential services? How do we provide support for each other within those services? How do we better coordinate what countries like South Africa and Kenya, you're seeing that data already exists, like people are already collecting data. So for example, recently in South Africa, they mentioned that they've got over 87,000 cases open already. We know that that's possible in Nigeria, but we don't have those numbers yet. So how do we better work together to coordinate to ensure that we're collecting all of this data and that we can do the analysis and we can do the research? How do we become creative in making sure that we're reaching people? So yes, of course, the jingles, we're putting as many helplines as possible. You have centers who are willing to stay open. So you have Miraval Center, that's a sexual assault referral center. They made sure they could get transportation from Lagos State. They made sure that they could at least be able to open from 10 a.m. to 2 p.m. So you're seeing those kind of things. You're also seeing that in terms of SRHR services, that doesn't go away, right? Or for women who are pregnant, during a lockdown, how are they supposed to get to a facility? Because taxis no longer are running, buses are no longer running. So of course, that's another advocacy that we need to go back to the government to say, you need to provide it. But you're also seeing Lagos State being able to be giving birth during this period, or who has any emergency surgery, that they wouldn't have to pay any fees whatsoever. We're hoping other states could do that, and we want to push it in other states and continue, of course, to leverage on technology. It's imperfect, but it's better than nothing. So that if you do need someone to talk to, if we do need to do counseling over the phone or conflict resolution over the phone, and that's already been done, we can at least do that until we know that you need a shelter or we need to remove you from harm, and then we'll do something about that. There's also the need for a very strong prevention campaign, which I think a lot of us are also working on how do we provide information on those who no longer want to be abusers, or those who say, I need help and I need somebody to talk to. How do we make sure that that information gets to them, and we do that? So I think it's quite important to continue to push for things that we've wanted before COVID-19 came in, but to continue to ensure that COVID-19 provides the opportunity to make sure we get all the services in. How many shelters can we get during this time? How can we make primary healthcare facilities that the closest one in the communities, first responders, really, the first place a person goes to? How can we make sure they have all of the information before they refer? And I think those are all very critical and important things that we are pushing for. Sometimes it can feel very demoralizing because you feel like you're pushing for it, and even if you don't have the research in Nigeria, you're saying we're seeing the trends from around the world and we know it's happening here. How can we make sure we respond before things get too bad?